when we do have depression, when we do have anxiety, when we do have negative emotions, these are functional adaptations to dysfunctional environments. So this is our body warning us that there's danger. This is our body warning us that we've got, stressors that are too much for us to really be able to handle. So if our entire focus is just on personal resilience without really looking more broadly at the structures that are causing us to have problems with anxiety and depression to begin with, then we're kind of missing the mark.
Hello and welcome to the Weight Free Wellness Podcast. I'm Tara Bachland, and today's episode is with Dr. Reba Peoples. I go through these podcasts a number of times, editing and so forth, and there's so many times where I just have a smile on my face, and I pick up on so many more nuggets when I re-listen to things, and this episode is definitely one of those. Dr. Reba is a delightful person and leaves so many helpful hints and tools just in this, it's not even an hour-long episode. And I encourage you to listen and to share because she leaves so many helpful hints for us to have a more healthy, stable mental and emotional life. So, psychiatry gets a bad rap because of all the medications that they tend to prescribe. And I really, really am a big fan of taking this approach to mental and emotional health. I'm having more and more guests on that are doing more live events, and we're doing Q&A sessions, really cool stuff like that. So whether you want to participate or just be notified of when you can listen to these, or just want to know how you can submit a question, an area that you're interested in learning more, go to weightfreewellness.com and subscribe to the newsletter. You'll see that in the upper right-hand corner, and you'll definitely be notified of those things. And also, while you're there, take the body typing quiz. It's really fascinating to learn about your body type and the foods, exercises, and habits that can help you to feel more balanced. So speaking of balance, Dr. Reba shares a ton of helpful information here, so I'm going to send you on your way to listen to this amazing podcast. Enjoy. Dr. Reba, thank you so much for being here today. I'm really excited personally to learn more about functional medicine and how it relates to psychiatry. And I've been reading some really good books, and it's brought up in different realms. So as you can tell, I'm pretty excited to talk. So thank you so much for joining us today.
Oh, thank you for having me. I'm excited to be here.
Well, I was really enjoying reading your website. You have some really good articles, and what I like is that they hit on a subject. So without going too deep into that, I just want to say, it's like I feel like I know you a bit already and really jive with you. I'm curious though, your website is, call it Imara or Amara?
Yes, Imara.
Imara Health and Wellness. Does that have an origin? I'm curious.
It does. It's actually a Swahili girl's name, and it essentially means one with strength or fortitude. And in the Arabic tradition, Amara is actually a boy's name, and it means one who builds or constructs. So my goal with my practice is really to empower patients with the tools that they need to become stewards of their own health and architects of their own destiny. So I think with traditional psychiatry, oftentimes people sort of rely on medications or rely on the practitioner to be sort of this person who confers health upon people. And really with functional medicine, our goal is to empower people to really recognize that they're the ones that ultimately are responsible for making those choices that really help them achieve wellness.
That sounds like the perfect name. That's really neat. How did you stumble upon the name Imara?
So I don't have children. So I think that my business is my child, essentially. So if I were to ever have a child, that would have been the name that I would have chosen. So
yeah, I can totally get it when you put. Similarly, my business is that way for me too. Uh-huh. Do you have any fur animals, kids at home?
I don't. No, I'm allergic to cats. I owned a cat, but I had to give him up, unfortunately, because of my allergies.
Oh, what a bummer.
Uh-huh.
Well, I can totally relate how work can be your baby at times, but I'm very fortunate that my work, well, I'm sure like yours, it involves people, so you're not alone by any means. Well, right. So I love the philosophy of functional medicine. I've had a few other practitioners on, but would you just do us a favor? And you kind of already did summarize what functional medicine is, but if you wouldn't mind maybe sharing again.
Oh, sure. So functional medicine really attempts to identify the root cause of why we may be struggling with illness. So rather than focusing on symptom management, we really try to take a deep dive and really look at, what are the modifiable lifestyle factors that may be causing someone to feel ill. So, are you getting enough sleep and relaxation? Nutritionally, are you eating the right foods? Are you moving your body? Are you managing stress? What's the quality of your relationships? And then we also look, biochemically. So what's going on in terms of your ability to, assimilate nutrients, your ability to make energy, your ability to fight off infections. We look at communication pathways, so looking at things like your neurotransmitters and your hormones. So we really take kind of this comprehensive, holistic view of health rather than taking a reductionistic view that kind of tries to focus on one organ system and, match medications to symptoms affecting specific organ systems.
Mm-hmm. It's so fascinating, and it's which is obviously why I have guests repeatedly on who are in the functional medicine realm. And I'm curious, your original training is in psychiatry.
Correct. Mm-hmm.
So what got you interested in adding functional medicine to your psychiatry practice?
And I think for me, I chose psychiatry as a resident because I was so fascinated by my inpatient psychiatric experience. So with inpatient psychiatry, we see people who are, really very ill. So they're, struggling. So with, suicidality or active psychosis or people who are in manic phases. So for me to see people take a medication and be able to sort of resume their lives was just fascinating to me. But I found that once I was actually in practice and treating people longer term, oftentimes I would find that people would get better with medications, but they were simply existing. So rather than really thriving and loving their lives and, having lots of energy and motivation and drive and passion, people were just sort of existing. So functional medicine for me really allowed me a chance to offer something more than that to patients. So, my patients now are really excited about life. They've got lots of energy. They've got lots of passion and motivation. And that's really why I chose functional medicine, because it offers me a chance to offer more than just medications that can sort of patch up symptoms. Really takes a look at the entire person and it helps us create an entire picture of wellness, mind, body, and spirit. So that's really why I'm so passionate about it.
Yeah, that makes a lot of sense. So what point do people usually come in to see you, and maybe what makes sense to people to come to see you as a psychiatrist as opposed to maybe a counselor or a therapist, and what's the difference?
Mm-hmm. And I think with functional medicine, we're able to offer biological intervention, essentially. So I do offer talk therapy, but I also am able to offer specialized lab testing so we can really take a look and see, are there any nutritional deficiencies that we need to address? Are there any gut health imbalances that we need to address? Are there any problems with your energy metabolism pathways? So oftentimes when physically things aren't functioning as well as they should, people have a harder time with the therapeutic aspect of things because their bodies just are ill. So if we can get the body functioning properly, then the kind of mind and spirit aspect is a little bit easier to incorporate.
Mm-hmm. So what are some common examples that you see that of people coming in and the switches that happen?
Mm-hmm. So I guess common examples, a lot of people have problems with their gut health, surprisingly. So, our guts are very important in helping maintain our emotional health. And I think a lot of people are kind of surprised to learn that. But many of the foods that we eat can trigger inflammation in our bodies. So if you do have any hidden food sensitivities, for example, that might be sort of causing those inflammatory pathways to flare up. Removing those foods can make a tremendous difference in the way that people feel. Sometimes we can have an overgrowth of kind of negative sort of pathogenic organisms in our guts. So people who have lots of candida, for example, putting them on an anti-candidal diet and getting rid of the yeast in their gut can really help people make a huge turnaround in terms of brain fog and low energy and fatigue and those sorts of things. So, very simple changes can really make a huge impact in the way that people feel, especially when people have tried lots of different medications and haven't had success. People are kind of pleasantly surprised to learn that there are very basic lifestyle interventions that we can make that can really make a huge difference in the way that you feel emotionally.
I was watching one of your videos the other day, and you had mentioned, I'm sorry, I don't remember the exact quote, but you're talking about why your antidepressants may not be working.
Right.
And statistically, how there aren't very many people statistically that it actually does work for.
Mm-hmm. Mm-hmm. Yeah, so only about a 33% success rate with antidepressants. So for, a good 2/3 of people who take antidepressant medications, they just don't see benefit. And I think our understanding of depression and brain health is definitely evolving. So when I first trained, we had this sort of concept of depression as being sort of a neurotransmitter imbalance. So when we give SSRI medications, which are selective serotonin reuptake inhibitors, they're intended to kind of increase the amount of serotonin that's sort of available in the brain. But now we know that depression is much more complex, and there's actually a big inflammatory component to depression. So if we can do things lifestyle-wise to help sort of reduce inflammation, that's gives us a huge advantage in being able to help address depression and depressive illnesses.
Mm-hmm. Yeah, I was listening to a book, I have been listening to a book on mental health and holistic health. And it was the first time I heard someone say, from what I recall at least, that depression is a symptom. It's not necessarily the disease. It's a sign of this showing up in the body that something overall is wrong, where we've been looking at it as the disease.
Exactly.
That was like a big aha moment.
Mm-hmm. And for me, the analogy that I like to give to patients is that of, the fire alarm going off in your house. So if that, smoke detector goes off and it's making this loud, irritating noise, and the fireman comes up and shows up at your house, one of the first things he's going to do is silence the alarm. But if he silences the alarm and then leaves, he's not really doing his job. You're going to want him to, find where the fire is and extinguish it rather than just simply silence the alarm. So what medications help us do is they help silence the alarm so that we can get to a place where we are able to kind of sort out the root cause of what's causing that fire, if that makes any sense.
Yeah, that makes a lot of sense. I recently spoke with an author, and she's also a psychotherapist. Her name is Jennifer Kozak. And she wrote Healing Without Hurting, which is about children's autism spectrum disorder, ADHD, and so forth. And her experience not only as a professional, but then also having a son who developed these issues in young childhood. And so we've covered more of that in children, making that correlation with gut health and so forth. But what are the symptoms that tend to show up in adults?
Mm-hmm. So with adults, we see a lot of, we can see irritable bowel syndrome, for example. That's one of the kind of biggest diagnoses that we see with adults. And we can also see not necessarily gut-related issues, even though the gut is the primary problem. So people with celiac disease, for example, can primarily present with more kind of neurobehavioral issues. So people with brain fog and trouble with their concentration, or trouble with depression, or trouble with really severe anxiety. And we find that when you remove gluten, they get better, even though they didn't have those sort of the traditional symptoms that you would expect to see with celiac disease. So they may not have bloating or constipation or diarrhea or any sort of real symptoms gastrointestinally, even though it's a gastrointestinal illness that's really causing the problems.
Mm-hmm. Yeah, it's amazing how there's just more and more of these correlations being made. Mm-hmm. So what's a standard? You listed on your website, you have an acronym, it's SMART Wellness. Maybe share a little bit about that.
Oh, sure. So SMART is it's an easy way to incorporate those modifiable lifestyle factors into your life. And we know from kind of neuroscience research that our brains are plastic. So neuroplasticity really alludes to the fact that our environment really influences the way that our brains are sort of set up. And by increasing certain inputs into the brain, you can actually strengthen neural pathways that are involved with things like memory and concentration and self-regulation. And one of the key things that we can do for our health is get enough sleep. So the S in the acronym is sleep. We need an average of about 7 to 8 hours to get kind of enough sleep. And what sleep does is it helps us formulate long-term memories. It helps us, it actually helps our brains do kind of basic housekeeping. So I don't know if you've heard a few months ago, there was the big sort of hubbub over the fact that lymph had been described in the brain. So when we sleep, we open small little ion channels, and we actually clear out waste when we're sleeping. And one of those waste products is something called beta amyloid. And that's it's a protein that tends to accumulate in people who have dementia. So getting enough sleep can even be protective against developing cognitive disorders. So something as simple as getting enough sleep can have profound health impacts for us, health benefits for us. The M is about movement.
Can I go back to the sleep room just for a moment? Because I'm curious, is there a point where that beta amyloid is, like you have to get a certain quality, or is it time?
So it's a combination. So if you have enough accumulated, it can be neurotoxic. So when your neurons have a lot of this plaque, it can sort of set cascades into motion that can lead to the cell actually dying. So you do want to make sure that you're doing all that you can to make sure that you're getting enough sleep, you're getting enough rest, you're getting enough antioxidants, you're getting pretty much everything that you can do to make sure that that environment within the brain is healthy enough to sustain those neurons.
Mm-hmm. So if you're getting enough sleep, that you're more likely, at least if you're getting rest, like I'm just kind of wondering if there's a certain stage of sleep that kicks in, or.
So it's the deeper stages of sleep. So you do have to get into deep stages of sleep for those sort of housekeeping pathways to sort of kick in.
Okay. Thanks for clarifying that. Yeah. So the M in SMART after sleep.
And the M stands for movement. So making sure that we're moving our body, so getting enough exercise. And I think people tend to think that, they have to join a gym or, hire a trainer or do, spend a lot of money in order to be healthy in terms of exercise, but that's just not the case. So we know, just getting 7 minutes of high intensity intervals can be very effective in brain health and just overall wellness. In terms of studies, there are actually studies that have been done on aerobic exercise and depression. So people who get about 20 minutes of aerobic exercise 4 times weekly get as much benefit from that as an SSRI antidepressant for mild to moderate depression.
That's amazing.
It is
worth repeating. 4 times a week, 20 minutes?
20 minutes, as effective as an antidepressant for mild to moderate depression.
And that's aerobic exercise.
Yes. Mm-hmm.
Is it specifically the intervals, or can it be, brisk walking?
It can be any sort of aerobic exercise. So if you're walking, I guess you'd have to walk pretty quickly. So you do want to get your heart rate elevated. But, being on the elliptical machine or being on a treadmill or jogging, anything along those lines can be enough to help reduce inflammation and really help with overall brain health.
That's amazing.
So we've got a very potent internal pharmacy that we can activate just through exercise.
Mm-hmm. Yeah, and it's important. I'd love, I do this podcast because I learn a lot, which is, I love learning about this subject, but there are so many of those little tools, and our bodies are so adept at being able to heal themselves. And sometimes we just need to do those little things.
Oh, exactly. And they're like drops in the bucket. So, one thing in isolation may not make a huge impact, but when you're doing everything together, then it definitely has a cumulative impact on wellness. So, I tell patients, sleeping 8 hours a night isn't going to prevent you from getting dementia if your, diet consists of, cheeseburgers and Sour Patch Kids. I mean, you do have to do, a little bit of other work as well. So.
Yeah, there's that too. So movement. So really pretty reasonable, and about anybody could get that amount of movement in. It's nothing outrageous.
Exactly.
Yeah. Mm-hmm. How about the A in SMART?
And the A is really about awareness. So, awareness can involve mindfulness. So kind of present moment, being fully present in the moment kind of defines mindfulness. And that kind of helps us kind of bottom up. So when we think about how our brains are organized, kind of the most primitive part of our brain is the part of our brain that's really responsible for those survival mechanisms. So, fight, flight, fleeing, feeding, and fornication. And when we do meditate regularly or engage in mindfulness activities regularly, we help get into sort of the front of our brains. So kind of if we think about our brains being sort of organized in layers, so we have that initial layer, which is the survival layer. The second layer is more of the emotional brains. So that has to do with our, feelings of sort of felt safety. Our limbic system is in that area. And then we have the cognitive brain. So the cortex. So when we do kind of meditate regularly, we sort of decrease those inputs from the more survival-oriented portions of our brains and help increase the capacity of the thinking portion of our brains. Mm-hmm. Another aspect of awareness is kind of attitude. So if you think about, cognitive behavioral therapy, we talk about, automatic negative thoughts. So, for the average person, we have anywhere between 40,000 and 60,000 individual thoughts in a single day. And for the average non-depressed person, 65% of those thoughts are actually negative. So something as simple as, going to the grocery store, I'm not going to find a parking spot close to the door, and they're not going to have what I need. And when you get up to the line, oh my gosh, is this person seriously writing a check? Who writes checks anymore? I should have gotten into the other line. So just all of these things that just sort of ruminate in our brains. And what this does is it triggers a stress response in our bodies. So people who do tend to have more of a positive internal thought world tend to have a more positive experience of life in general. So I talk about kind of avoiding the ants with people, those automatic negative thoughts. And that also really helps in terms of overall sort of sense of wellness and well-being. So that would be kind of the A portion of the SMART acronym.
I was amazed that you were saying for the non-depressed person of
non-depressed, yes.
5% of the thoughts are negative. How do you teach someone to be aware of when a negative thought is coming up? Because you're not there all the time and you're not in their head every moment. So how do you teach someone to become aware of that?
And really, it's about just sort of recognizing when you're not feeling good. So, I mean, I think there are times when we can sense that we're feeling sort of revved up or feeling sort of anxious or feeling out of sorts. So in those moments, if you can sort of take the time to just sort of examine what's going on internally right now that I'm starting to feel this way, either physically or emotionally. And a lot of times you'll find that, when you do sort of an assessment of what's going on cognitively during those moments, then you'll find that a lot of those thoughts are trending more toward negative thoughts.
So be aware of your feelings. Like, your feelings are indicators. It's so funny you brought up the example of, oh my gosh, I can't believe she's writing a check. Like, I've been there. I totally think that. And I try to be totally like mellow and stuff, but that's one I was like, oh my gosh.
Right.
So sorry to anyone out there who does write checks in the grocery line. I'll take a deep breath.
Right.
So awareness. So you're talking about meditation and mindfulness, but also mindfulness activities. So can you do either or do you always recommend meditation? Or what are some examples of the mindfulness activities?
So mindfulness doesn't have to be, I think a lot of times people tend to think of mindfulness as, being seated perfectly quietly in lotus position, meditating. And to get benefits, you actually don't have to meditate in that way. So anything that kind of gets you fully aware and fully present is beneficial. So that could be things like yoga. It could be things like or qigong. It could be drumming. It could be walking meditation. So there are many things that can be done that can get us into that place of stillness and presence in the moment.
So you teach them and use them interchangeably, the meditation and mindfulness.
Yes, so meditation would be considered a form of mindfulness. So mindfulness is more of the kind of broad umbrella term.
Yeah. Well, that's great. I think even for me, the term meditation has been scary in the sense of, how am I going to do that?
Right.
It's like the simplest thing, yet the hardest thing. But if we can still gain benefit just by taking a walk where we're more present, and which I find when I go for a walk, I love going for walks, not in February in Minnesota, right. But I find like it's almost always about 20 minutes into the walk. Like there's a certain time for me, at least, where it naturally happens. Like I just, all of a sudden I'm not thinking about all the other stuff. And I notice myself being mindful by not being mindful of all the other stuff I was thinking before.
Exactly.
Yeah. And you get your exercise at the same time.
Right. You get a 2-for-1.
Yeah, totally. So that was awareness in SMART.
And then the R is recognition. So really recognizing that your identity is very separate from the role that you play in life. And as an explanation, generally, if you were to ask someone to, tell me about yourself, most people will say something along the lines of, well, I'm a doctor, or I'm a lawyer, or I'm a teacher, or I'm a wife, or, whatever the case may be. And those things actually don't define who you are. They define what you do in the world. And when we sort of pin our identity on our role, anytime that role gets threatened, then our entire sense of identity has the potential to crumble. So if, someone were to base their entire identity on being a wife, what were to happen if they get a divorce? So people can, tumble into a really profound depression after losing a relationship if their entire sense of identity was wrapped around being in a relationship. So really recognizing that who you are is a perfect, whole, and complete human being or spirit in evolution who has value simply because you're here, not because of what you do, not because of what you own, not because of what you possess, but simply because you are.
Mm-hmm. I would imagine there would have to be some kind of exercise you run people through to get in touch with that Do you have
Yes.
something that you could share? Because that's really abstract. It's inside of us, but it can be hard to get that vantage point.
Mm-hmm. And I generally ask people who they are. So I just ask sort of a series of questions. Tell me about yourself. Okay, tell me about yourself. So people generally start out with the roles, and then as we sort of progress through the exercise, then it starts to become a little bit more focused on who they are as individuals. So, initially people may start out saying, well, I'm a teacher and I'm a wife and, I'm a college graduate. And then eventually they start saying things like, well, I'm a loving person and I'm curious. And, so all of these other sort of adjectives sort of come into play. And in doing that exercise, people are able to sort of recognize the shift. And then we sort of kind of go into sort of teasing out, well, what part of this is a role and what part of this is kind of innate to who you are.
Yeah, that sounds like a great exercise. And that maybe with a good friend, you could even sit and work with each other on that.
Definitely.
Yeah. What kind of changes do you notice in people when they can really, if they've been identifying with a role as opposed to their inner self, what kind of changes do you see happen?
Well, people are generally able to be more authentic versions of themselves. I think that when people are sort of role oriented, people tend to live their lives for other people, if that makes any sense. So rather than sort of making decisions that are fear-based, well, I can't do what I really want to do because it's not popular. People might not like me. I might offend somebody. People start making decisions out of being in alignment with purpose. So rather than kind of running away from life, people tend to shift to a place of moving toward life. So rather than moving away from pain, moving toward things that are fulfilling and pleasurable and feel good.
Mm-hmm. That's so interesting because as you were describing, I was thinking of an example that maybe the person who over-identifies, or like the mom whose kids grow up and she's made herself as the mom for so long. And this is probably a classic example, but you could do it even as a relationship, like you mentioned the relationship, or maybe the spouse dies. And, obviously those would be the dramatic kind of tearaways, but how do you become that whole person without having to have a tragedy or happen or just have life kind of force it upon you somehow? So I could see it would be really, really valuable.
Oh, definitely. And unfortunately, as you said, it typically does take a tragedy for people to come around to really recognizing that. Because I think as human beings, we tend to, we enjoy being comfortable. So we enjoy what's familiar. So if things are just sort of coasting along and there isn't too much pain, we're not likely to make major changes.
Well, and our society is so based on roles. When you're a kid, it's what are you going to be when you grow up?
Right.
I mean, there are some child rearing techniques that are more around helping the child discover themselves. But for the most part, our culture is, who are you? What do you do?
Right.
What are your roles? So yeah, there's some work to do in that area.
Oh, definitely, for sure.
That's a really good one. So that's the R in SMART. What's the letter T?
And the T is about tailoring inputs. So what is it that you're putting into this beautifully designed body of yours? So we have to think about nutrition. So food is kind of one of the primary ways that we nourish our bodies. So making sure that we're eating nutrient-dense whole foods and trying to stay away from food-like substances. So another thing I like to tell people is that if something comes in a bag, a box, or a can, it probably shouldn't go into your body. That, or if you can't pronounce the ingredients on the food label, then it also probably shouldn't go into your body. And the reason for that is, food can be a big inflammatory trigger. So if we are eating foods that are toxic to our bodies, then that can also make us very ill. We also want to make sure that we're hydrating our bodies efficiently. Most of us don't drink enough water, and we need water to really detoxify our bodies. So a good amount of water to drink is about half an ounce to an ounce of water per pound of body weight daily. So I weigh about 120 pounds, so I try to drink about 100 ounces or so, 120 ounces if I'm really working out more regularly. We also want to think about what we're putting onto our bodies. So we talk a lot about, what we put into our bodies, but what we put onto our bodies is just as important. If we think about our skin, it's one of our largest organs, and it's very porous. So we can absorb a fair amount of what we put onto our skin. So if you think about, the bottle of lotion that you put on, that you're using to moisturize your skin, if you wouldn't feel comfortable drinking your bottle of lotion, why would you feel comfortable putting it onto your skin? Because you're absorbing all of those chemicals. And at least for women, when you sort of take into account all of our personal care products, so from, shampoo to makeup to moisturizers, we take in an average of 160 different artificial chemicals daily. So really trying to get to a point where you're using cosmetics that are food grade quality rather than ones that are filled with lots of chemicals that can be endocrine disruptors or other toxins. Another form of kind of input into our bodies would be media. So what sorts of entertainment are we allowing into our subconscious minds? With advertisements, unfortunately, advertisers really rely on exploiting our insecurities. So, we see beautiful people in beautiful homes with beautiful houses and seemingly perfect lives. And what we do is we subconsciously compare our lives to the lives that we see on television. And then we think that, well, if I had those products, then my life would somehow be better. So really being aware of that and a very conscientious consumer of media. And then just, looking at things like violence. I mean, I really love The Walking Dead, but it's probably not a good, in terms of, my overall mental health, it's probably not the greatest. So, you want to be very careful about, what it is that you are exposing yourself to. And then the last input would be relationships. So, are you surrounding yourself with people who are nurturing and supportive and loving? Or are you surrounding yourself with people who are toxic? And loving someone unconditionally doesn't mean that you have to put up with bad behavior. So you can love someone from a distance if they are not bringing good things into your life.
That's another one that's, to me, was the most challenging. It's easy, relatively, it's easy to make the diet changes, even no matter how hard that is still.
Right.
Like those relationships, especially if the longer you've been in them, that may be normal.
Right. Mm-hmm.
And it's interesting because as I interview people, I like to interview people who also have healing stories. Mm-hmm. And there's definitely commonalities. And I recently interviewed a man, his name is Jack, and he healed himself twice of cancer. Oh. And he actually brought up the point that, I don't remember how we got around to it. The right things always come up in the interviews in my mind. But he mentioned that he actually ended up eliminating, I don't know if he said that word, about 80% of the people that he was previously engaged with. Now, I'm not saying that's necessarily what everybody needs, but that's what he needed as a part of his healing process. Mm-hmm. And, that can be so challenging, even just from my own experience, because we hear, blood is thicker than water. And, our culture kind of, speaking of media too, we see families together, we see friends, even the old TV program Friends, they were friends for how long? Forever. So do you have some tips that how you guide people through, first of all, knowing whether someone is a healthy relationship to have a relationship with, and two, how to healthfully maybe cut ties or keep distance?
And I think it partially comes down to trusting your feelings. So if you are around someone and you kind of dread picking up their phone call when you see that they're on the caller ID, or if you have to go spend time with them, it's like torture. then you know that, well, something is probably off about this relationship. So then you do have to do some of your own internal work to really explore what that is. And I think that once you do get to a place where you've done your own healing, that's another big part of it. Then we're less likely to allow other people to influence our own sense of self-worth and value and self-esteem. So I think kind of once you are in a stronger place emotionally, then you're able to really separate kind of the story from the event. And by that, I mean, typically when something happens, there's, the set of events, the set of circumstances, but then there's also that added layer of all of the extra stuff that we add on to it. So it could be that, someone forgot about a lunch date. And, that person forgot about a lunch date. That's what happened. But what the story that we create in our minds is, this person doesn't respect me. This person doesn't value my time. This person hates me. So all of these other things that just sort of get run rampant in our minds, rather than really recognizing, okay, this person forgot our lunch date. Mm-hmm. So having that kind of solid sense of self and sense of self-esteem helps us not tend to sort of allow those stories to run rampant and make us feel bad about ourselves.
Mm-hmm. And I hear a theme. So again, you mentioned notice your feelings. Mm-hmm. It's interesting. Even kind of going back to that depression is a symptom of, mm-hmm. of something going on in your body that's not quite right. So it's like we're built with these messengers mm-hmm. in our body, and the feelings have a lot to do with it.
Oh, exactly. Exactly. So when people say, trust your gut, there's a lot to back that up scientifically. I mean, so when we think about, our nervous system, we actually have an entire nervous, wouldn't say a nervous system, but we have the enteric nervous system in our guts. So we have all of these inputs that kind of connect directly with our central nervous system through our vagus nerve. So when we are feeling stressed out or overwhelmed, we do send signals to our stomach, and vice versa. So when you do feel that tightening in your stomach, or feel nauseated or ill when you're anxious, that's because your body is really communicating a signal to you that something isn't quite right. So we do have to be aware enough of our bodies and aware enough of those signals so that we can act to try to correct whatever it is that might be causing that imbalance.
Mm-hmm. It's just fascinating. I'm amazed by how many of these terms we have in our common language. Mm-hmm. Which came first? Did we know about these things at one point and it developed in the language and we forgot and just it stayed in our language? It's really amazing.
Uh-huh. Definitely.
Recently, I've been asking some guests who are more in the mindfulness genre or in mental health, emotional health especially, is, there's a lot going on right now after the not only election, but the inauguration. There's been, we talked about media, and I'm wondering if you have a few thoughts or words of advice on how to deal with all really the chaos in a way. There's anyone who's on Facebook can see it. Definitely any kind of media that you're plugging into, you can see it. Do you have any things that you have been sharing with patients or just been thinking and are dying to share with us?
I mean, I think for me, with Facebook, it's really about protecting yourself. And there are a lot of sort of memes going around about, Sally is a Republican and Joe is a Democrat, but, they're still friends because they're adults and that sort of thing. But, the reality is Facebook is your sort of private digital space. So if there are things coming into that space that are upsetting to you, that are causing problems, then you've got to curate that space for yourself. So if that means unfriending people who may say things that are inflammatory or things that really make you feel upset or agitated, then that's your right to do. If you need to change your settings so that you are no longer receiving updates on your timeline from certain people, so you can unfollow people rather than completely unfriending them. That's another, route to go. But you do have to really be careful about that, your personal space, and it's okay to do so. And also really recognizing, kind of going back to those 3 layers of the brain. So we have kind of that fear-based center in our brain, we have the emotional center, and then we have our rational thinking brain. And oftentimes, media oftentimes and politicians oftentimes really try to trigger those kind of more primitive emotional portions of our brains. And when you are in that sort of fear-based response, the kind of higher cortical thinking brain shuts down. So really being aware of that when that's happening. So when you do find yourself getting sort of revved up and agitated, just thinking, well, am I being manipulated here? So, really going and trying to really decipher the facts, and recognizing that we do have power. So in spite of, what's going on in Washington and what's going on more broadly around the world, collectively, we do have the authority to make changes. So recognizing, what we can do that's, within our power to make change. So if that's calling your Congress people, if that's writing letters, if that's, going down to town hall meetings, so whatever it is that you can do to really feel empowered rather than powerless, then I would say that's what you should do.
Mm-hmm. Yeah, there are multiple approaches, which is nice, which is why I've been asking a number of guests recently, because they're, everybody has a little bit different tactic, and a reminder just about, knowing the Facebook settings and what you can do on there is very helpful also. And I'm sure to some people too, like they feel like they have to do something, like it stirs in them even more, just personality wise, if they don't say something or do something.
Right. And recognizing, your own limits. So yes, it is important to speak up. It's important to speak out, but it's also important to really honor your own body and honor your own limits. So there are times when you've just got to sort of take care of yourself, and that's okay. And once your batteries are recharged, then you can get back out there and keep fighting the good fight. But in the meantime, it's perfectly okay to take that time to rest and restore and rejuvenate.
Mm-hmm. I really appreciated one of your articles in particular. You talked about resilience, but in starting to enact a plan. And I thought that was really important, because in psychiatry or psychology, I don't know about psychiatry, but definitely I've heard in psychology that resilience is actually promoted as a good thing. You want to have resilience as a human being. But what I understood you're pointing out in the article is that there's a point where resilience, you're so resilient, you're not actually making progress.
Exactly. So
having a plan.
And I think with resilience, oftentimes it tends to be used as an excuse to blame the victim in a sense. And not that we are victims, but what I'm saying is that when we do have depression, when we do have anxiety, when we do have negative emotions, these are functional adaptations to dysfunctional environments. So this is our body warning us that there's danger. This is our body warning us that we've got, stressors that are too much for us to really be able to handle. So if our entire focus is just on personal resilience without really looking more broadly at the structures that are causing us to have problems with anxiety and depression to begin with, then we're kind of missing the mark.
Yeah, it was a really good article. I definitely encourage people to check out your site. There's some good resources there.
Oh, well, thank you.
Yeah, you write really well, very clearly.
Oh, thanks.
So kind of in conclusion, I like to leave people with there's already been tons of resources that you shared already and tips, but in conclusion, I realize that the functional medicine model, depending on the practitioner that you go to, they may or may not take insurance. And, just like any medical treatment, it costs money. And unfortunately, it doesn't seem that these more holistic models are really being adopted across the board into the insurance realms. And I'm wondering if maybe you have some ideas on how people can start implementing these things, healthy practices into their lives in a low-cost way.
Mm-hmm. And at least kind of when you go back to the SMART acronym, the majority of things in the acronym are completely free. So it doesn't cost any money to get enough sleep. It doesn't cost any money to really move your body. So there are plenty of exercises that you can do just using your own body weight. So you don't really have to have a gym membership necessarily to get a good workout. Awareness practices are free. Recognition is free. And really, thinking about, nutritionally, that's a little bit more tricky because, to eat, well does require an investment. So I think it's really a matter of thinking about your wellness as an investment in your future. So, rather than thinking along the lines of, I can't afford to eat organic food, long term, you kind of can't afford not to. And then in terms of health, it's really a series of decisions. So we can't always make perfect decisions, but we can always make better decisions. So it may be that you can't afford the fresh organic vegetables, but if you can afford fresh vegetables that are maybe non-organic, that's a better choice than not eating vegetables at all. Maybe you can't afford fresh vegetables, but you can afford frozen vegetables. That's a better choice than vegetables in the can. So there's this sort of hierarchy of decisions that we do have to sort of think about when we're trying to make better choices in terms of our health.
Mm-hmm. Oh, those are great points. So, thank you so much for being here today. I think we covered a lot of great stuff, or at least I really enjoyed it.
Thank you.
Yeah, absolutely. And how do people learn more about you?
So my website is imarahealthandwellness.com. IMARA healthandwellness.com. And I do have a blog there. I probably should update it a little bit more frequently, but there is information there. And then I also have a website or an email newsletter that people can sign up for on the website as well. And I also have a Facebook page, and I actually plan to start doing more Facebook Lives so that people can sort of call in and get their health questions answered through Facebook as well. So
that'd be great, especially in this realm and day and age with anxiety and depression. Depression seems so common that that would be really helpful people to plug into. Mm-hmm. Well, again, I so appreciate you being here today and sharing with us, and have a great evening.
Oh, thank you. You too. Take care.
That was really a great episode with Dr. Reba. And if you're wondering how you can share this with a friend, there are a couple ways that are really effective. You can go to your favorite, if you're already subscribed, go to your podcast app and you can share that with a friend. You can usually text them. It doesn't tell you them which episode you're listening to, so you'll want to just say, hey, listen to number 55. This was really great. Also, you can go to iTunes and just share how valuable this content is. It helps other people who are considering listening to know how good this content is, and goes a long way and helps us out a great deal too. And I love hearing from you. Hit us up on Facebook or Twitter or Instagram. Just say hey, or let us know what's on your mind and what you'd like to learn more about next. I'd love to hear from you. Take care.